This is DIY fatty liver. These are the sorts of conversations I introduce through my new Undoctored book, Undoctored, Why Healthcare Has Failed You and How You Can Become Smarter Than Your Doctor. And I really mean that. In many instances, you can do a better job than your doctor, better results, better health. Because the doctor, when it comes to fatty liver, is waiting for a drug to come out. And there is none right now, but he's waiting for one. Or a procedure. Or may say things like, cut the fat in your diet, which is wrong. That makes it worse. So fatty liver suffers from a bad name. Fatty liver. It makes it sound like fat in the diet causes it, but that's not true. Fat in the diet does not cause fatty liver. Carbohydrates in the diet cause fatty liver. That is sugars, sucrose, fructose is really bad. Any source of fructose, including honey and maple syrup, high fructose corn syrup, of course, agave, and the amylopectins of grains, flagrant contributors to fatty liver. And that's because there's a process called de novo lipogenesis, conversion of sugars to fat, triglycerides, that is reflected as high blood triglycerides as well as fat in the liver. So that's from carbohydrates and some other causes as well. So the components of the Undoctored, Wild, Naked, Unwashed program, a 6-week program, address many of these causes. We start with grain elimination and sugar elimination. That alone is incredibly powerful to reverse fatty liver. We also cultivate bowel flora, very, very important in your long-term recovery and improvement in liver function. So very important to follow the undoctored approach of a high-potency multi-species probiotic, occasional fermented foods, and a program of prebiotic fibers. Not difficult, but you got to do it and do it long-term. Fish oil, another one of the 6 components of the Undoctored program. I advocate 3,000 to 3,600 milligrams per day of EPA and DHA divided in 2 doses, and that also adds greatly to reversing fatty liver. It's important not to drink alcohol. Alcohol in modest quantities is benign for most people, but not when you have a damaged liver from fatty liver. So absolute avoidance of alcohol is very important because it's a liver toxin, even in small quantities. Intermittent fasting, also discussed in the Undoctored book, is very helpful. But don't undertake intermittent fasting until you finish the full 6-week program, because it takes that long for you to gain full control over appetite. It's much easier, much more pleasant, even enjoyable when you fast after the 6 weeks are over, because you've lost the opiate peptides that come from the gliadin protein of wheat and other grains that drive appetite, make you hungry all the time. Once you're free of that, fasting is easy. There's another video on fasting. There's also discussions in my Undoctored book and Undoctored websites and some of my videos on YouTube about intermittent fasting. Very, very important. Bottom line, you can reverse fatty liver quite nicely. It may take a few months, sometimes a little longer, but you can do an incredible job of full reversal, as provided you haven't gotten to this stage of cirrhosis. You can get full reversal by doing all these things on your own. And you can even track your own blood work. You can go to the lab, some of the labs that have direct to consumer lab tests, and you can test these labs yourself, the AST and ALT. You can even do a finger stick through ZRT labs. So you can do this on your own, and you can obtain far better results. It would be nice if you did have some benign guidance, someone just giving you a little feedback, some kind of healthcare provider. But the truth is, you can do a job, you can do a good job, you can do a better job than the doctors do at this.